with inflamed polyps. So there are two characteristics of CF patient. The CT scan, CT characteristics for CF patient. One is, the polyps are very common, and two is they tend to have hypoplastic, which is underdeveloped sinuses. And we think the reason for underdevelopment is because of the chronic inflammation and the infection filled with polyps. So there's a very poor aeration to the sinuses. So and most of the time there's sphenoid sinus is involved. Like 43% of the CF patient, they will have a underdeveloped sphenoid sinus compared to only 3% of patient with chronic sinusitis but without CF. Lastly, to diagnose sinusitis, sometimes we will do a sinus culture. So the purpose of the sinus culture is not only to diagnose sinus infection, but also to help us to determine a culture-directed antibiotic treatment, especially in suspicion of resistant organism. And we do this often for CF patient. So here are just a list of common organisms in CF patient. Just name a few: Staph aureus, H. influenza, Pseudomonas. In terms of treatment of cystic fibrosis, there are two. Oh, I'm sorry. Yeah.
When you do the culture, can you actually get inside, like the maxillary sinus, to have access to it?
Yes. So let me go back. So in this patient's case, so this patient has never had sinus surgery. So what we're looking for is, so this area is called the medial meatus. There are several sinuses drain into this common pathway: the frontal sinus, the anterior portion of the ethmoid air cells, and also the maxillary sinus. So if you see pus here, it could be from any of those locations, right? But if we have a patient who had the sinus surgery, presumably the sinuses are still open, then we can actually pass the endoscope all the way inside and see the source of the pus. Yeah. Yes?
About the different specimens, are they treated like sedentophilia and things like that? Do you see a lot of that, those smaller bacteria, or are they just pretty much Pseudomonas and Staph?
The ones we listed here, they're the common ones. We do see some rare ones, but the common ones I would say is the top three. Yeah.
The bacteria, that's an bacteria. Those are more as common, are they?
They're not common among patients with chronic sinusitis, but they are common among patients with CF. And even among patients with CF, I will say still the top three. They're the most common ones. Yeah. Okay, so treatment of sinusitis, medical treatment and surgical treatment. So first we're going to talk about the medical treatment. So basically involves antibiotic treatment or anti-inflammatory agent. So antibiotics could be delivered either orally, you take the pill, or topically. Topical antibiotic can be more effectively delivered to the sinuses after sinus surgery because the sinuses are open. So therefore they're less useful in unoperated patients. The topical antibiotics can potentially treat resistant bacteria without IV antibiotics. There are a wide range of therapies available, and it may potentially avoid any systemic side effects. And the topical antibiotics could be delivered through saline spray, saline irrigation, or a nebulized treatment. So here's just a list of the common antibiotics that could be used as a topical agent: gentamicin, tobramycin, ceftazidime, and mupirocin ointment or Bactroban. That's the brand name. Clindamycin, Cipro, or levofloxacin. And we listed the concentration here as well. It's important to to know their caveats of topical antibiotics. It still has the potential for development of resistance over time. It may have its own side effects. Patients could complain of diarrhea or dizziness at times. And there are actually rather limited published clinical data out there to talk about the effectiveness of the topical antibiotic treatment. The irrigations appear to deliver more effectively than the nebulizers. Actually, Dr. Wang had a study that's published in the American Journal of Rhinology in 2006, comparing different mechanisms delivering topical antibiotics, and he found out the topical nasal irrigation or sinus irrigation deliver the antibiotic more effectively than the nebulized treatment. Yes, ma'am.
Back a couple of slides, and you went through those kind of fast, and I didn't quite catch what you were saying the irrigation includes, because you're talking about saline and saline spray and nebulized, but where is the antibiotic? And those aren't antibiotics.
Yeah, no, yeah, those are not antibiotics. I'm just talking about the method to deliver the topical antibiotics.
Do you put it in with the sinus spray? I mean,
yes.
rinse?
Yes.
You add it to the bottle?
Yeah.
Okay.
Yeah, we do. And we can talk a little bit more at the end of the of this talk in terms of how exactly we do it. Yes.
For our patients, just in reference to her question, the most effective seems the Bactroban with the Pulmicort in the saline irrigation twice a day. It decreases the inflammation, and it also helps them with some suppression of frequently their Pseudomonas.
Yes, actually, we use that often for our patient with chronic sinusitis with CF or without CF. It depends on their culture, and their response to the treatment. Yeah. Okay, all right, and then the other major medication category is an anti-inflammatory treatment for chronic sinusitis. So it includes oral corticosteroids like prednisone, Medrol. Topical steroids, again, could be delivered through irrigation, like the Pulmicort sinus rinse, or spray. This is your Flonase, Nasonex, Rhinocort, and etc. And also allergy therapy. Don't forget allergy therapy in patients with chronic sinusitis or CF, they could have allergies, and their allergies need to be treated. It's getting darker. So the topical nasal steroids, they're the anti-inflammatory. It provides topical anti-inflammatory effect. They're effective for allergies, nasal polyps, general nasal swelling. They're non-addictive, so it's safe to use long term. Requires daily use for maximum efficacy. Yes?
With regards to non-addictive and safe to use long-term, the utilization of steroids, I know on a cream form, is somewhat regulated because it thins the skin. Does it thin the mucosal lining to make you more friable on your vessels and possibly cause nosebleeds?
I'm not sure about thinning the mucous membrane, but a lot of those topical steroid nasal sprays, it has a drying effect. My understanding is it has a little bit of alcohol in it. So the correct way of delivering those nasal sprays is important. So if the spray, if it's mainly deposited along the septum, then you have a chance of nosebleed over time because we have very rich blood supplies to the septum. So it's very important. So we'll tell the patient to put the tip of the spray inside of the nose and then tilt it to the outer corner of their eye, so it doesn't end up depositing on the septum. Yeah. So the epistaxis or nosebleed is a complaint from our patient. So oral steroids, those are the steroid pills. The very potent anti-inflammatory agent. What it does is to decrease the white blood cell migration, decrease the production of inflammatory mediators, and decrease the histamine release, and therefore decrease general swelling. It's potent and it also has some long-term or short-term side effects. If you ever taken it, you're probably familiar with some of the side effects. Short-term include insomnia, elevated blood sugar, irritability, just kind of mood swing, increased appetite, and weight gain. Long-term side effects include osteoporosis, cataracts, thinning of the skin, and easy bruising. So we're very careful in terms of providing oral steroid treatment, considering those short-term and long-term side effects. So how much medication is too much? And so that's a question of what's considered to be a maximum medical therapy for chronic sinusitis. It's a 3 to 6 weeks of broad-spectrum antibiotics, culture-directed if possible. That's why the sinus culture provides value. 2 weeks of concurrent oral steroids in selected patients. Again, we're very careful giving out oral steroids. Topical nasal steroids, saline irrigation, and also treatment of environmental allergies if it's indicated. So there are a lot of medications. And at some point, we have to look at the possibility of surgery instead of giving multiple courses of antibiotics and steroids. So when to consider surgery? When there are persistent symptoms despite of maximum medical therapy, when there's still evidence of sinus disease on post-treatment CT scan. And we typically, so this is the time we would repeat the CT scan if it's indicated, and the timing of the CT scan is typically 2 to 4 weeks after you finish a course of maximum medical therapy. And we would consider sinus surgery if there is still endoscopic evidence of persistent sinus disease, such as like a severe septal deviation. No medication or spray would correct that. Pus or extensive polyps. This is a fun slide. I always like to play this slide. So what comes to mind when you hear the word sinus surgery? Is it black eye? Or does it bring back the horrible experience from your previous sinus surgery? Or is it pain? So in the old days, sinus surgery are rather painful, and there are a lot of bruising involved, like what you saw in the picture. And there are external incisions, and there are a lot of packing. The technique is, stripping the mucosa, the lining of the sinuses, which is destructive and non-physiologic. And the modern technique for functional endoscopic sinus surgery is actually developed about somewhere around 25 years ago, if I'm not mistaken. Dr. Wang is here, and he can correct me, please, anytime. So nowadays, the sinus surgery, they offer less discomfort. There's no bruising. It's done endoscopically, so it's within the nose, so there's no external incision. There's no packing, virtually no packing. Therefore, it's considered minimally invasive. And the surgeon will not strip the lining of the nose and will try to preserve the tissue. And it's done mostly outpatient, so you have the surgery and you go home the same day. And the goals of endoscopic sinus surgery are to enlarge the drainage pathway of the sinuses. Remember, the natural opening is only 2 to 4 millimeters in diameter, to remove the polyps and to hopefully to break the cycle of obstruction leading to chronic sinusitis and to improve the lung function. And it's important for patients to remember that surgery is not a cure. It's an adjunct, not a substitute for medical therapy. Here's a short video of a pre-op patient with nasal polyps. So again, So this is the left side of the nasal cavity. Here, is a big polyp coming out of the middle meatus, coming out of that area. And now we're going, sort of hugging the floor, going to the back. And now you can see some thick drainage. And this is the posterior portion of the inferior turbinate. It looks kind of swollen. We call that polypoid swelling. And again, this is the nasal pharynx area, the very back of the nose. And then we tilt the scope up a little bit. And now you can see in this space is filled with polyps as well. So every time when you see a polyp, inside of the nasal cavity, and a lot of times their sinuses are pretty filled up with the polyps, and it's coming out into the sinus cavity already. This is the other side of the nose. It has a similar pictures, so I'm going to stop it.
What is the cause of the formation of a polyp?
We don't know. We know it's an inflammation of the lining of the nose and the sinuses, but exactly what causes or triggers the nasal polyps, we don't know. But we do see it, among patients with CF, asthma, and hay fever. Not everybody has it, but a lot of those patients have this condition. It's an inflammatory disease, that's all we know. Yeah. So this is a video of a patient, not the same patient, but a patient who had a polyposis or polyps and had an endoscopic sinus surgery and is completely healed. So again, this is the left side of the nasal cavity, the septum on the left. Here's the middle turbinate. So now you can see actually this is the opening into the forehead sinus, the frontal sinus. It's wide open. So here's the skull base. So the ethmoid air cells, they're opened already. And this big opening is the, going into the maxillary cavity. So you don't see polyps anymore. So remember this slide we had at the beginning of our talk, talking about the sinuses, the mucus in the sinuses doesn't really drain by gravity. It drains, in the case of the maxillary cavity, is against the gravity, going through the natural opening. So, the endoscopic sinus surgery enlarges the natural opening of the sinuses of the maxillary sinus, but in CF patient, in order to further facilitate the mucus clearance, the surgeon will often enlarge the natural opening all the way down to the floor of the sinus and make a huge opening. We call that, the regular maxillary sinus surgery is called a maxillary antrostomy. And for CF patient, it's called mega maxillary antrostomy, so make a big opening. So remember the natural opening of the maxillary sinus is, so if you visualize as a cavity, is located to the anterior and the superior portion of the cavity. And so not only the surgeon will enlarge that natural opening, but also make the enlargement all the way down to the floor. So it has a big opening. And why do we do this? The reason we're doing this is to, obviously, to facilitate the clearance of the maxillary cavity, but also to facilitate the delivery of any nasal sprays or sinus irrigation down the road. So here's a intraoperative picture of a patient. So just imagine, so here is the natural opening of the maxillary cavity. I believe this is on the right side of the patient's nose. And a regular maxillary antrostomy sinus surgery, the surgeon will just enlarge the natural opening to about this big, okay? And for CF patient, what the surgeon will do is to further enlarge this opening all the way down to the floor of the nose. And then it will look like this. So this is a big opening. And you can imagine when you rinse the nose, the liquid or the spray, it has a better chance to reach the lining of the maxillary cavity. So, so quickly, I want to talk about one of the new technologies used in functional endoscopic sinus surgery, which is computer navigation. Navigation is a tool by which the surgeon can track the instrument in relation to patient's anatomy. Tracking technologies perform very similarly to satellite navigation for geographic positioning by precisely and dynamically tracking and the signals from the trackers on the surgical instrument and also on the patient reference device. And as data from the tracking method registers to the navigation system computer, it is visually merged with the pre-op CT scan on the system monitor in real time. And this allows the surgeon to track the position of the surgical instruments throughout the procedure. So here's just a setup of the computer navigation. So this is the patient reference device. There's trackers on the surgical tube. So, you know, when doing the surgery, the surgeon will look at this screen. But if there is any doubt in terms of where exactly, you know, we're at, then we will activate the computer navigation system. And on this screen, it will show something like this. So here you see the surgical tube is inside of sinus cavity. So where is it? So when the computer navigation system is activated, it will show exactly where the instrument is